It's great to be with both of you today, Lauren and Gina from Mobius MD. Excited to do this conversation with you, learn a little bit more about the solution, the results you're seeing in the market, and what you have planned next. But let's start with just some introductions. Tell us a little bit about both of your roles before we get into it.
Sure. Yeah. I am Lauren. I'm a senior account executive here at Mobius. I've been here for about 6 years now, so it's been really cool seeing like the company grow, new features, new products we release. So my goal is to like help onboard providers, train providers, just walk them through the sales cycle and just make sure everything is the most efficient for what they need and just make sure that they're all set by the end.
Wonderful. And Gina?
Yeah, I'm Gina. I've been with the company for about 2 years now. My role is the customer success management. So I help onboard customers and do training sessions throughout when they're using the product. So yeah, it's been great watching Lauren and working with the company. It's been exciting releasing the AI.
Great. And it's both of you are working with customers closely, so it'll be great to hear any stories and anecdotes of how they are working with the product. What do they like? What do they want more of? But let's start with the core problems you're looking to solve. So, I always like to start with why, because we don't want to just find solutions for no problems, but what are the core problems that you see your company saw in the industry that you were looking to solve, and why are they important, and why are they important now?
Sure. Yeah, so definitely physician burnout is top of mind for our company. So, providers work with various EMR systems, various computers. There's just so much information aside from just their clinical day-to-day of like admin tasks that they have to do. So we're trying to help really alleviate all of that burdensome documentation time so they can just focus on their patients, give better care. So we're just helping with our app. Like the app can pretty much like formulate the note for the providers so they can just focus in on the visit during the visit time.
Got it. So it's largely alleviating some of the documentation burden for physicians. And are you primarily focused on physicians or a broader clinical team?
Yeah, great question. So we work with all types of providers. So like MDs, NPs, POs, or DOs, like all types of providers really. So our focus is really on the provider. And then, of course, we work with administrators to help like, get their providers started, but the app is really just geared for providers.
Got it. Okay, so let's dig into your solution. Tell us about it. I know you might want to bring up some slides to show as well. So I'll let you tell us a little bit about the product and the solution.
Sure. Yeah. Thanks, Sonia. So just wanted to walk y'all through our new Conveyor AI application, which we've coined the cure for documentitis. So as I said a little bit before, physician burnout is top of mind for us in helping providers. So we totally understand the provider's workflow is time consuming, complex, and just exhausting having to document in various systems on the computer, various computers as well. So a little bit about how it works. You'll use your iOS device as your listening tool. So you'll have Conveyor AI running on your iOS device, and then you'd see your patient as you normally would. At the end of the encounter, you just tap a generate summary button. And then from there, within about 30 seconds, you'll get that fully generated SOAP note ready for review. So you can easily convey that into your EMR. So just a little bit about our features. The app is HIPAA compliant, HITRUST certified. It works with both Mac and Windows computers, as well as Surface Pros, Chromebooks, so really like any type of computer it'll work with. We do offer dictation with it. So especially like how we differentiate is that we do offer Mac compatibility, and then we do also offer dictation with it. So it's not just AI. If you need to like add or edit any of your notes, you can use dictation with it as well, which is really nice because some solutions just have AI, but then of course they need to like add notes or maybe dictate outside of the AI generated note. So if you want to dictate like a letter or just dictate really anything, you can use the dictation with it. So you can use this with all EMRs, all devices. It's EMR agnostic, so it's not just tied to like one EMR. You can use it with, Athena, Epic, really any EMR, any system at any time. It is also very accurate and instant. So you're going to get that AI generated note within about 10 to 30 seconds after the note is complete, which is super quick, which is really nice. And it's going to be so accurate. So none of it was like written by like a live human or anything. It's just automatically done by the AI with our new AI documentation feature.
Okay.
So in terms of results, we've seen about an 80% time savings compared to manually charting. So you can get a fully completed SOAP note ready for review within about 30 seconds. Sometimes it's as quick as like 10 seconds. And then we've also seen a higher consistency quality of notes. So there's no like margin of error for like a human that's writing it, since the AI is very intelligent. It's just super quick and easy and very highly accurate. So just a little bit about background about Mobius. We've been around since 2012. We are physician-backed, based in the United States, and have an entirely in-house team. So like sales, support, engineering, everything is within our company. You're not going to be working with like any third-party resellers, anything like that, as we do offer an end-to-end service. And definitely recommend checking out our app store. We have a lot of nice reviews that providers can check out, especially admins. It's always nice to hear from like the end user. And definitely recommend checking out our app store page for that. And then, of course, for time savings, especially when you're factoring in like the ROI of investing in like a subscription like this, in terms of time savings, this is just like a mock-up of like a typical provider we work with. So we're finding it saves about 8 minutes per encounter, which when you compound that, when you look at it per week, you're saving about 10 hours per week, which is a lot of time back in that provider schedule. And, you know, you can choose what you want to do with that. If you want to see more patients, if you just want to have more time back in your day to do other things, this is just a really great app to save time, spend more time with your patients, and just give better care. So that is for the product demo portion. This is just a little bit about our technical requirements. So an iOS device is required to use the app. So any Apple iPhone, iPad, iPod Touch works great. We don't offer an Android app just due to security reasons. Having an internet connection is required to use the app. So you can either use Wi-Fi, cellular, the computer and the iOS device don't have to be on the same network. So whatever's quicker, you know, you can use cellular if that's quicker. And then in just a second, I'll show you how to connect the iPhone to the computer. So you can use our QR software or a USB device. So what I'm going to do here is I'm going to minimize this. And then you'll see here, I've just mirrored the iPhone on the computer screen. So you see that here. And then I've also mirrored our QR software. So this is how you connect the iPhone to the computer. So what I'm going to do is I'm going to hit the start camera button, scan that QR, and then that'll actually pair that iPhone to the computer. So providers can install that QR software really on as many computers as they need. So in terms of like how we differentiate as well, it's super portable. You can install that QR software on as many computers, like your personal computer, your work computers. Even if you work at a hospital, we have a really nice conveyor USB device, which you can just plug into the computer as well. So I'm going to walk you through just a couple of features in the app. Our new AI feature is going to be right at the bottom. So essentially, when you start a new encounter, you just tap on add. From there, you go to patient details. And let me open up a little example here so you can see what I'll do is I'll tap on that pencil icon, take a photo from the EMR, grab a photo. So we have like first name, last name, date of birth, ready to go. So you just go to patient details, tap on the listening button, and then you see your patient as you normally would. So very, very easy. This is just one that we've already generated. As you can see, this was all written by the AI. So objective, assessment and plan, really nice and clean. You can format it if you want like a bulleted format or a numbered list or paragraph format, or if there's like any other AI sections that you want to add in, you can also do that as well. So in terms of getting this note into the computer, you can convey it into any computer, any EMR. So I'm just going to use this Notes app here, but this could be like Athena or Epic. You just, wherever you place your mouse cursor on the computer, that's where that note will go. So what you'll do is you'll just swipe over, tap convey, and then that immediately conveys straight to the computer. And then, of course, we know some providers, their EMRs have it sectioned out where they have like different fields for each section in the EMR. So what you can do is you can go to the carousel mode up top, and then you can just place your cursor into that field, move your cursor to the next field, tap convey, so on and so forth. So some solutions that we've seen on the market, they tie directly into the EMR, which is great, but you are limited to that one EMR, especially if providers work at like different clinics, have different EMRs. This just makes it like the usability is so easy because you can use it with any EMR at any time. And then, of course, we do offer dictation built in with it. So what you can do is you can just place your cursor really anywhere on the computer, tap the microphone button to dictate, or if you want to like add or edit any of your notes, you can just place your cursor inside of the note and then tap the microphone button to dictate. One thing to note is that the AI only knows what you tell it. So like, let's say there was something that you didn't want to discuss in front of the patient. You can either dictate that into the note, or you can actually just talk to the AI. So even if the note has generated, let's say you want to add more things to it, you can just tap on the microphone button, just kind of talk to it what you want to add, and then regenerate based on those new findings. So as you can see, the interface is just super easy. One thing to point out that especially how we differentiate as well is going to be our support. So you can always go to our support and reference section, tap on chat with us if you have questions. We have a really great help center. So just the app is so easy and intuitive. After onboardings, the providers can really get started with it in their clinic. And then another thing to point out is that the SOAP note is not just limited to the SOAP note format for the encounter template. So of course, if you want to add in other AI sections, you're welcome to add in that. So these are all of our AI sections that you're welcome to add in. Orthos have different needs, maybe like an imaging tab. For psych visits, we have, other things that you can add in as well. So we also have over 50 medical specialties for you to choose from. So definitely gear it to your speech specialty, depending on what specialty you are. And then also along with, dictation and AI, let's say you just want to dictate a note on the go. You can always go to our memo section, tap on add, and then from there you can dictate, store your notes safely in here for dictation. And then once you're back at the computer, you can just easily convey that straight to the computer. And I'll show you how to dictate. It's very, very easy. You just place your cursor, just like when you convey that encounter to the computer, you just place your cursor where you need to dictate, tap on the microphone button to dictate. So I'll give you an example here. I'll dictate. The patient states that she has an upper respiratory infection with rhinorrhea, congestion, sore throat, and coughs in 6 weeks ago, period, new paragraph. Insert surgery consultation, new paragraph. So just did a quick dictation up here. As you can see, everything is populated, made for medical terminology. And also what's nice is that, especially, providers dictate the same things a lot sometimes, like, consent paragraph or just things that they commonly see, especially if they're a specialist. They can always set it up as a template inside of the app. So they can just easily dictate, insert the name of the template, and then that will immediately populate that body of text. So these are really easy to set up in the app. You just go to our speech tools sections, go to template library, and then from there, create your template name, dictate that body of text, and then you're all set. Additionally, outside of those speech specialties that you can select from, we do have a vocab section. So in terms of training it, things like physician last names, hospital names, things that aren't necessarily medical terminology. We definitely recommend, training your system for vocab. And then that way, our goal is like when you dictate, everything is spelled correctly. There's no need to go in and edit. So this just makes, like, with the templates and the vocab and the usability, it's just try to make it like as easy as possible for the provider, for the end user. But yeah, that is pretty much it for the product demo. Gina, anything that I'm leaving out for the
I mean, no, for the AI, I think the main thing that we've heard from our customers is that it is so much more detailed. The summary is the quality of the note summary. There's a lot of AIs on the market right now, but they have seen that ours is way more accurate and detailed than some of our competitors. So that's one thing to note when you start using the AI. That's the main thing we've heard from our users is that while there are other competitors that are, out there, our note is definitely superior what the AI is capable of writing. So I think that's definitely a standout point for our current users.
Definitely. Yeah.
Awesome. Well, I think you covered a lot of the questions in this discussion already. You just talked about what makes your solution different. You showed us a little bit of your KPIs. Anything more to add on the metrics or KPIs beyond what you covered already?
Yeah. So especially when we look at like time savings, we quoted about 10 hours per week and about 80% of the note is generated. When you look at especially the ROI of the subscription cost, you're not only going to be seeing, like, let's say you were using like a live transcriptionist, a live scribe. It's definitely way more cost effective to have like an AI solution. Not only is it more cost effective, it's always with you. So, you have to factor in sick days and turnover, churn, things like that. So the AI is always with you. As well as time savings. So about 10 hours per week, which is definitely substantial, especially energy savings. So, providers that even dictate, it's very efficient to dictate, but this is even light years beyond dictating because like your note is ready to go by the time you finish the exam, which is great.
That's awesome.
Yeah. And then just wanted to highlight that we do offer free trial. So it's like no commitment. We don't require any credit cards or anything like to start the free trial. It's a very, very easy onboarding process. So we advertise a 7-day, but it truly is actually a 14-day fully featured free trial. So in terms of getting started, what you would do is you would just book a session on our onboarding link. And then providers are welcome. We'll do a Zoom session where we'll walk them through the app, make sure the app's downloaded on their iPhone, computer, make sure they're all set. And then they'd have a full 14 days to trial it out. And in that time, they can really see, the time savings that we're displaying.
That's great.
Yeah.
Well, thank you for going through all this detail and sharing some of the products, sharing in-depth demo. This has been very insightful. Any closing thoughts before we close our time together?
Yeah, no, it's been great chatting with you, Sonia. We actually just launched on the AVIA Marketplace a couple months ago, so I definitely recommend just checking out our page on the AVIA Marketplace. We have some videos, some photos, just some more information, things that I may have forgotten today. So definitely check out our marketplace page. And, if you're just, admins, if you're looking to get your providers to save more time, reach out. Providers, if you're looking to save more time, reach out. You don't necessarily have to have a large group. We work anywhere from like solo providers to larger groups, all specialties, ortho, everyone, pediatricians, women's health, everybody. So just main goal is if you're looking to save more time, just feel free to reach out. And our website's Mobius.md. So you can just request a demo there and then we can walk you through how to get started.
That's great. Well, thank you for joining us. And as Lauren said, reach out to the team at Mobius if you want to learn more or find them on AVIA Marketplace as well. Thank you both.
Thank you.